So let's talk about indications and contraindications. So okay, and then contraindications. Okay. So just like massage or any type of touch therapy, if someone had a broken bone, we're not going to stretch that area until it's healed, right? If they had torn ligaments or they had tendons that had damage to them, we're going to want to use caution and really work with both that client, that patient, in how much can they stretch, but also with their physician. So in many cases, they'll have a physical therapist or physician they would have gone to. If they don't, then you want to make sure that there's at least 6 weeks after any type of injury like that where they've had a chance to really just heal. Because in the beginning, if you have an injury, if you sprain your ankle, if you do something, tweak your knee, if you pull a muscle or tendon, things like that, initially you usually need some rest. So you just need to allow them to have some time just to rest. And then they can start with more gentle movement, and then we'd move into the stretching later. But you want to give that at least 6 weeks, okay? So you don't injure them. So we could go into contraindications, like obviously we're not going to work on someone if they are in acute contagious sickness, right? Because just common sense. And then we are going to, mostly the main thing here with contraindications is just making sure that you don't overstretch the tendons and ligaments and the muscles, so that you're able to prevent further damage. So it's really pretty simple. The main contraindication, even though we would, if someone has cancer, so you know how we go over all these contraindications in massage, all those things still stand, that you want to use common sense and you want to be gentle with this person. But overall, the main thing when we're talking about stretching and what the difference is that we don't want to overstretch. Okay? Muscles, tendons, or injure ligaments. Okay, so if you remember, tendons connect muscle to bone, and then ligaments connect what? Right, bone to bone, correct. Okay. So whenever we're doing any type of stretch, we're going to be working with muscles, tendons, ligaments. We're going to be working with nerves. We're going to be working with circulation, all those things, right? Okay, so we want to be really careful not to overstretch, and so we have to have good communication. And then you can use your common sense understanding of the other things like acute illnesses, broken bones. We're not going to aggravate anything that's already aggravated. Like if they have a bruise, we're not going to want to. If they're bruised here by their hip, that's not a good time to stretch. But these things seem like common sense. We still have to, I want to refresh your memory though, because those things still are like the sort of obvious contraindications that need to be restated. Okay. So indications. Oh, also contraindications. If somebody has like a hip replacement or a knee replacement, things like that, then you're going to want to have really good communication with them. It depends on the surgery and it depends on the individual patient. There's things like age. There's things like their fitness level before and after that surgery. And so some people can have really great mobility with those types of replacements. Other people have limited ability to really stretch and move. And so you're going to want to just communicate with them and kind of find out, and also you'll feel it in their body, kind of what point you start feeling that resistance in that stretch. So that communication and that just paying attention is going to really solve that. You can ask them if there are any directions they move in that are painful. So you guys can hear this is very common sense, but it's still worth like going to and thinking about. So hip replacements or knee replacements or any other joint replacement. And it doesn't rule them out as a contraindication. It's in that realm of caveat, where we just want to exercise caution and have more communication. Okay, indications. So the main thing that we're trying to do, what do you think the main thing is that we're doing with stretch? Say a little louder.
Just increase mobility.
Yeah, increase mobility. So mobility and flexibility. And then when we have, and then we also have balanced muscles, meaning balanced muscles and skeletal alignment. So that each side has that mobility and that flexibility. So that's going to help you now. It'll also help you as you age, because do you think that having mobility, flexibility, and balanced muscle and skeletal alignment, is that going to help you with your balance as well? Yeah, absolutely. And it's also going to help you reduce pain, because you're going to be balanced. You're not going to have your muscles pulling more on one side, your nerves pinched. This is really going to go a long way with the massage that you guys do. And also just on its own, really helping people to have that alignment so that they're out of pain. Okay, so it's really important. Okay, so that's all we're going to do on that. What questions do you guys have? Short class, simple. Any comments about this? Anything else that you guys think needs to be up there right now? In general type things? Yeah. Rehab?
Yeah, for sports.
Oh. Yeah, definitely. Indication. So any type of rehabilitation. And so if we're going to say that, and that's really good, rehabilitation, we can say maintenance. So for maintenance and overall health, yeah, that's good. It's good to think in that vein as well. Yes. So it's good for maintenance and it's good for recovery. Yeah. And it's good for prevention also. So we could also put that on there. Yeah.
Longevity.
For longevity, for sure. Yeah. Longevity. Yeah, if you've got that balance and you feel good in your body, is that going to probably help you with longevity? It's going to, yes, help everything work better. And it's going to help your psychology support that health and longevity. So these stretches we're doing fully clothed. And there are many different types of stretch protocols. So I know that at Stretch Lab they do PNF. So proprioceptive neuromuscular stretching, facilitated stretching. And that idea is where you go ahead and you stretch a little bit, and you don't take them to their full range of motion. You stretch a little bit, and then you have the client push against you and resist, and then you push back a little bit more. And so we may do a class on that for fun in the future. Right now we're going to do the Thai stretches, which are more yoga-like and flowy. Okay. But I want you to know that there are many different types of stretching, and it's actually fun to explore all of them. Okay. All right, so we're going to start with the legs. So we'll start with one, and I'll stand on this side. So we're going to go ahead and get into a lunge and just hold right above the ankle and hold at the hip, and we're just going to lean back and traction that leg. Okay. So just tractioning that leg. And then we're going to bring their leg up, and we're going to come around, and we're just going to push that leg down. So straighten your arm, good body mechanics, push their heel down towards their glute. Does this all look familiar from Thai to some of you? Okay. All right. And then I want to make sure that I'm following the protocol that I put together for you guys. And then the next thing we're going to do is we're going to compress on the center of the glute, and then we're just going to lift the bent leg. So I'm going to make a fist and have my arm be straight, and then I'm going to reach underneath the knee, and I'm going to press here, and I'm going to go ahead and just lunge to the side. So he's super flexible. Lunge to the side and hold for about 10 seconds, and then bring that leg back down. Okay, the next one that you see is the figure 4 stretch. So I'm going to bring this leg down. I'm going to reach across to the opposite leg, bring the leg into a figure 4, bring the medial side of his foot over the top of that popliteal space, and I'm going to bend the leg that I'm nearest. Okay, and then this time I'm going to go ahead and reach underneath the knee. Okay, and I can lift just like this and support his leg, or I could also press my fist right into the center of the glute and then just lean to the side. This changes the stretch just a little bit. Where are you feeling this, Kai? Where do you feel it there? Because he's so flexible. Okay, where do you feel it?
Low back.
Low back? Okay. And then you can do another press on the side of the low back, kind of on the sacrum. Where do you feel it now?
Quad.
Yeah, in the quads. It'll change where they feel the stretch a little bit. Okay. With these stretches, so with that one, you're just going to go straight kind of towards the center of their spine. With the one where I was pressing in the center of the glute and then just lifting, you can take that stretch like this and hold, and then you can bring it out a little bit and stretch and hold and then come back. And you can continue to even move it out just a little bit more if you want to. Okay, so you could get a few stretches out of that one. All right, the next one that we're going to do, we'll do this whole section and then we'll do it together. So then we'll just traction the leg and hip and then bring that leg back down. Then we'll do it on the other leg. Okay, are you guys ready to do this together? So we are going to take our client's leg. I'm on the left leg, but it really doesn't matter. Just make sure you're doing both sides. Stand kind of to the side of the table and behind it and get in a lunge. Okay, we're going to support at the ankle on both sides of it. So, and then you're going to kind of hold by the heel. Okay, and we're just going to lean back and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and slowly release that traction. Walk over to the side of your clients by their thighs. And then we're going to bend the leg and bring the heel to the glute. So go ahead, if you are on that left side, you're going to take your left hand and place it over the dorsal side of the foot. Okay, if you're the other side, you'll do the opposite. And we're going to go ahead and just straighten your arm, and bring their heel to their glute. Heel to the glute. Okay, go ahead and release. Was that enough of a stretch? Okay, was it a little too much? Okay. Okay, and now we're going to take, if you're on the left side, your right hand goes underneath the knee, so around the knee, cups around. If you're on the right side, it'll be your left hand, okay? And we're going to go ahead and let that leg be free. It'll stay there, and press with your fist into the center of the glute, and then lunge to the side. Yeah, and you may need to move up towards their back a little bit. So stretch right there. Okay, and hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And if you're in a lunge, this will be better for your body. Okay, bring that leg back down. Okay, all right, the next thing that we're going to do is compress on the center of the glute. Okay, lift, and we're going to move to another angle. So we're going to do this again, and we'll move their leg out just a little bit. So go ahead and get in a lunge. So your knee that is closest to the face curl is going to be bent. And we're going to go ahead and press in the center of the glute, bring the leg towards you a little bit, and then lift again. So, okay, right there. Straighten the arm, pressing into the center of the glute. Hold. We're about 5, 4, 3, 2, 1, and slowly bring that leg down. Okay, good. Figure 4 is next. So go ahead and bring that leg out. Reach across. So get into kind of a lunge to the side so you're not hurting your low back. And reach over and bend the leg across from you. Slide it out into a figure 4. Place their foot into the popliteal space on the leg closest to you. And then bend that leg that's closest to you. Okay? And we're going to feel this stretch in a little different place. So you can check with your client and see where they're feeling the stretch. Okay, we're going to take our right hand, reaching under the knee. Let their foot be supported kind of with your arm and your shoulder. Press into the center of the glute with a fist and get your knee that's closest to the face curl bent, and then lunge. Straighten your arm. 2, 3, 4, 5, 6, 7, 8, 9, 10, and then bring that leg down. Okay, check with your client and see if they felt that stretch in a different place than the one without the figure 4. Did you feel it in a different place? Yeah. Okay. So bring the legs out. Okay, and then we're just going to traction that leg again and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That looks good, Susan. Okay, so let's go ahead and move to the other leg. Yeah.
When you do the ankles or the wrists, do you feel like there's laxness, like it's just really lax?
Yeah. I hold up higher. So I'm not actually holding right on the wrist or right on the ankle. I'm holding the heel and then right above the joint. Yeah. And it stabilizes everything a little more. It's an excellent question. Yeah. Okay. You guys ready? Okay, we're in a lunge and we are holding. We're on the other side, the leg we haven't worked on yet, and we're going to lean back in traction. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release. Bring the leg up. We're going to go ahead and we're going to push that heel towards the glute, pressing on the plantar surface of the foot. Okay. And now we're going to reach. So I'm on the right side, so it's with my left hand. I'm going to reach underneath and around her knee and cup her knee. And then I'm going to make a fist and place it in the center of the glute. And I'm going to change where I'm lunging. So I'm lunging forward, and I'm going to lean forward. 7, 6, 5, 4, 3, 2, 1. I can bring her leg down, and then I'm going to move it out just a little bit. Is that enough of a stretch for you? Okay. Okay. And then lunge for 10 seconds. 2 and 1. This is about 10 for me. Okay. Okay, we're going to bring her leg down now for figure 4. You guys are all doing really good. Just go ahead and slide her leg out. Outside leg comes out. Foot goes into the popliteal space. You could probably move his leg out just a little bit more, Jerry. Yeah, so it's his actual foot. Yeah. Yeah, that's great. Okay. And then we're going to go ahead and bend the knee, sealing this. And we're going to reach around the knee. Their foot ends up being right by our armpit and shoulder. We're going to press with our fists into their glute and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Release. And then your hand goes on the sacrum to one side and press and lunge. 2, 3, 4, 5, 6, 7, 8, 9, 10, and then slowly release. Okay, we'll bring the leg down, and then we're going to traction that leg again when you're done, holding for 10 seconds, coming down and holding for 10 seconds. I'll do this with you. Yep, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Okay, if you guys wanted to, there's so many. I cut a lot out so it'd be simple enough for you guys to learn this as an intro. But you could also add in, some of you have done Thai massage, you also could add in that foot cross stretch and then just lunge and lean forward and hold for 10 seconds. Yeah. And then you can switch the feet and just make this easy on yourself. Pretend like you're a superhero and this is no effort, and then it really does become no effort. So straighten your back, And just lean forward. Is this too much, Sarah? Okay. Yep, so just lunge. Yeah, good. And press. That looks beautiful, Jen. Okay, and then bring their legs down. Yes?
So if you were going to incorporate this like into a 90-minute massage first, then stretch.
You could do it any way you want to. There's no right or wrong with that. You could incorporate stretches throughout your massage. As after you work on each thing, like after you work on the legs, you could do these stretches. You could do all the stretches at the beginning. You could also do them all at the end. So obviously you would then need draping. And right now we're not learning draping techniques, but we could do like a complimentary class on that later, and that might be nice for everyone to see how to drape using these stretches. So yeah, but there's no set rule on it. You really would just use your own intuition on that. Yeah, where to bring them in. Okay, let's go ahead and switch partners. Okay. Robert, are you able to be a model for one round? Well, Sarah needs to give to someone. Yeah. I was going to have you do that. And I still need a model. Yeah. Okay. Oh, okay. So I brought in 2 face cradles. So, surprise. Do you want to go into classroom 7 is open and just grab another face cradle? Okay. Okay. Thank you. Okay. Thank you, Robert. Okay, so all of our clients are in prone. That's great. We got to wait for Kylan too, so you guys are fine. Okay. We'll have you just lay face down. Okay. There's your shoes. Welcome. Okay. Okay, I'm starting on the left leg, but there's no rule with this like there is with Thai massage. Start on either side as long as you work both. Okay, here comes Kylan. Do. What?
You should sing him in.
Write a song for him.
So quick.
That's a good idea. If you guys want to warm up your hips, Tui setting a good example for all of us.
I just realized if we're going to stretch, I better like pre-stretch before I die.
Yeah, it's smart. Okay. So we're going to go ahead and hold the ankle on one side and then hold the heel. And you're going to be in a lunge. So stand kind of to the side of the table in a lunge. Yep. And you're going to go ahead and stretch back. Tractioning their hip. Hold for 10. So 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and release. We're going to walk to the side of our client. We're going to stand up by their hips now. Take your hand that is more superior with respect to the client's body and go ahead and just straighten the arm and bring their heel. So just straighten the arm and bring their heel towards their glute. Is that a stretch for you, Robert? Is it too much? Okay. Okay, go ahead after you've held for about 10 seconds and then slowly release. Okay, so now we're going to take our free hand. We're going to reach around the knee. Okay, and we're going to place our fist. So for me, it's my left hand. I'm on the left side of my client. If you're on the right side, it'll be your right hand that's a fist pressing into the center of the glute. And we're going to, for the left, if you're on the left side, I'm going to be in a lunge with my left knee bent. If you're on the right side of your client, it'll be your right knee. And we're going to go ahead and lean to the side, straighten your arm. And you may need to move up more by their back if they're more flexible. So hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. We can move that leg out just a little bit. And then press and lift in your lunge. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, go ahead and bring their leg down. Okay, so now we're going to do figure 4. So bring the leg back down, reach across to the other leg. So when you reach across, you want to be in at least horse stance, because if you're standing like this, you're going to hurt your back. Okay, so you want to be in kind of horse stance. Reach under that leg, move it out, and then seal everything in by bending that leg that's closest to you. Okay. All right, so now we're going to take our arm that is closest to their knee and to their lower leg, and we're going to reach underneath that knee, and we're going to have their leg be supported right here by our shoulder. We're going to make a fist, press into the center of the glute, be in a lunge with your knee pointing up more superiorly with your client, and we're going to go ahead and lift and straighten your arm. Yep, lift and lunge. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. And then, so about 10 seconds. And then we're going to press right by the sacrum. Okay. And do the same thing again. And we're all at like different places, but we'll start now. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and bring that leg back down. That's great. Okay. Go ahead and traction that leg a little bit. Bring that leg down. And then we're going to traction for a count of 10. So traction at the end. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and let that leg come down. Okay. Let's move to the other side. And we're going to traction this leg. So in a lunge, one hand under by the foot, the other hand by the heel. If they've got lots of ankle issues, move your hand up further so that you're not right on that joint. Okay. If you can feel that there's just like a lot of laxicity and it just feels very loose. Okay. So holding at the heel and lean back. 10, straighten your back. 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and release that. Come up and stand at least by their hips. We're going to go ahead and press their heel towards their glute. So you can be in a lunge, you can be to the side. And just check and make sure that's a stretch for them. Is this a stretch for you, Robert? Do you want more? How's that right there? Okay. Okay, so about 10 seconds. So about a count of 10, okay? And then go ahead and release. Now we're going to reach underneath that knee. And we're going to press into the center of the glute. And we will lift and lunge in the direction that you are leaning. So 10 seconds, count of 10. We'll go 5, 4, 3, 2, 1, and then release. Did you guys all do okay with that? I sort of turned away during that one. Cool. Okay. Thanks, Rob. All right. Let's move the leg out a little bit and repeat this. Okay. And then we're going to press in the center of the glute, get into your lunge, and we're going to lift. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And go ahead and bring that leg down. Bring it all the way down, and then traction. Come down by their heel, and traction for a count of 10. So lean back, and traction for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and release. Okay, great job. Okay, let's have you guys try this with your partner. So go ahead and switch. Save your face coverings. You can switch them. What? Oh, I didn't do figure 4. You guys, I'm so sorry. I'm so sorry. But I know they've already switched. But what I'm going to have them do, Kylan, and thank you for figure 4. But what I'm going to have everyone do is actually do this on your own to lock it into your memory while I walk around and make sure that you know it. So, because if I have you do it just one time with me and then it ends, even though it seems simple, what I found is that no one remembers it. Okay, so go ahead and lay down one more time.
I'm just waiting, do we want to do figure 4 or just switch?
Let's do figure 4. I want to remind everyone figure 4. Okay. All right. So let me show you where we were so that I don't mess up anyone with the flow, because I know when I do that, it kind of can mess with people's minds. So we did, you can just watch for now. So we tractioned the hip for a count of 10. And then we brought the heel to the glute, count of 10. And then I came around and I lifted the leg, got into a lunge, count of 10 for this, brought the leg out a little bit, another count of 10, and then this is where I should have gone into figure 4. Okay, so you want to be in a horse stance, and you're going to reach across, bring their leg out into a figure 4, and then you're going to place their foot into the popliteal space, bend their leg, and if those of you who want to do this with me can, and then we're going to go ahead and just lift while pressing on that glute in a lunge, count of 10, and then pressing on the sacrum, count of 10, and then I bring the leg down, and then we traction for that count of 10. Okay? Okay. So I'll have you guys do this on your own now, and then go through all those movements, and then switch when you're done. Okay, so number 7, traction the occiput and the shoulder opposite direction. So go ahead and press by C7 on those erector spinae, and then pull back on the occiput. You're in a lunge. So counter stretch. So pretend like you're a superhero and you're putting just all that force into your arm that's pressing into the upper trapezius, and then you're pulling back. So hold about 10 seconds. Sorry, I didn't count. And then, but I would if I were not teaching. I'll count this time. Ready? We're going to go ahead and press, counter press. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Slowly walk on either side of the spine, those erector spinae musculature, and focusing on the intercostals, making it your intention to stretch and get movement in those ribs and all along the spine. So slowly, slowly, slowly.
Rebecca, does it matter how the client is breathing?
It'd be good for them to be taking nice deep breaths during all this. But you know what? They usually do start taking nice deep breaths during this. So you can tell them to focus on taking nice deep breaths, which is helpful. But sometimes when you do this and you're working along their back, especially their legs, the body takes care of it itself. And your client just naturally starts breathing in a way that's deeper and slower, more relaxed. And then coming back. You guys all look really good. Okay. Feeling the movement in their ribs, feeling what that compression does. Okay, so go ahead and move over to the side of your client so that you can face me. This first part. You're going to bring their arm behind their back, sit down on the table, slide your arm that's closest underneath their arm. Actually, you're going to go thread it through and under. So thread it through the space and under. Okay. Fingertips come up onto the shoulder. And you don't really need this outside arm at all, but if you want, you can support the outside of their arm, and you're just going to lean back and bring them with you. Hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and slowly release. Leave their arm here. Walk to your client's other side. Stand at about their waist, so just below their ribs and at their hips, okay? And then you're going to take your hand that's closest to the top part of their shoulders, and you're going to bring it around and hold under the pec attachments. Okay? You're going to take your other hand, come around the arm and match it. And you're going to traction. You're going to aim for their hip on the opposite side. Okay? So go ahead and lean towards their hip on the opposite side. Good. 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and release. Hold just above their wrist. Straighten their arms, step down by their legs, come into a lunge, and you're going to pull their arm down by the crease of the glute on the opposite side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then bring their arm down. Good. Okay. So you're going to stand this side now. You'll take this arm that's closest to you, and you'll put it behind their back. Sit down onto the table. Thread your closest arm to them through that space and then around the shoulder. And you're going to go ahead and lean back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then release. Leave the arm where it is. Move around to the other side. Stand down by their waist and hip, but you still want to be able to reach. So reach over the top of their shoulder on the opposite side, and then your other hand comes around the arm and matches it. And we're going to be aiming towards the opposite hip. So go down and to the side a little bit. 7, 6, 5, 4, 3, 2, 1. Go ahead and bring their shoulder back down, and now holding just above the wrist, we're going to traction, bringing their arm down towards their opposite leg. 6, 5, 4, 3, 2, 1. Okay, go ahead and bring their arm down. Okay, and then we're coming back. We're making this really simple, and we're just going to do our movement, stretching that rib cage. So just walking down nice and slow, getting movement through the ribs, moving that tissue away from the spine. If you're receiving and you aren't breathing nice and deep, can notice and change your breathing. Just some longer, deeper breaths. If you're finding as a therapist that your shoulders are hunching up towards your ears, that means your table really should be even lower if possible. Yeah. Once you've come back up to the top, we can go ahead and traction by the occiput. So your hand can even stay there on that upper trapezius, and then you're going to just lean forward in that lunge, traction in opposite directions, holding for at least 10 seconds. Yeah. And then when you're ready, go ahead and switch. Holding for at least 10 seconds. And then release. Okay. Okay, good job. We're going to start by compressing on one side by C7, T1. And the heel of your palm is kind of curved right around where the shoulder curves. Okay. So, like this is actually shoulder to the deltoid, but what we call the shoulder right by the neck, right? Like in common terms. So upper trapezius, and then our fingertips are going to be on that occipital ridge. And go ahead and counter stretch. So lunge to get that press. Straighten your arm and just hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and switch sides. Fingertips on the occipital ridge, heel of the palm by C7, and stretch 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, now getting some movement through the ribs, slow walking. All the way to the sacrum and then back up. Is this too much pressure? Okay, if it is, let me know, okay? Yeah. Yay. Okay. So tractioning that sacrum, one side and the other side. And you can stand to one side of your client while you do this. You just focus on having even pressure. That way your clothing won't go into their head. Also it's the outfit, right? The outfit. No, it's great. It's just right now, if you have a lot of material in that right at your waist, it's harder to not have it touch your client. Okay. Really tractioning and compressing, making that your intention as you work along here. Okay, so when you've finished, we're going to move to the side of our client and go ahead and sit on the side so you can see me. And we're going to bring their arm behind their back. And then we'll be sitting down on the table. We're going to thread our arm through the space we just created, and our fingertips rest around the shoulder. The actual shoulder this time. Well, the shoulder joint. Okay. And we're going to go ahead and lean back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and slowly, slowly release. Okay. Now move to the other side, keeping their arm behind their back. Stand down by their hips. Reach around over the top of their shoulders. Pec attachments. Bring your other hand around the arm and under the arm. And you're going to go ahead and lean back towards their hip. So their shoulders kind of moving towards their opposite hip. This is our intention. Okay. So hit 10, a count of 10, and I didn't do it. So 5, 4, 3, 2, 1. I start watching everyone get into position, and then we're all on different timing, which is okay for this. Okay, and now we're going to hold the arm above the wrist, and you're going to pull the arm down, traction it down slowly, carefully towards the opposite leg. Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release. Okay. Was any of that too much?
No, not at all.
Okay, good.
So good.
Thanks. All right. So now we're going to work on the arm that we're right next to. So bring the arm behind their back. Sit down on the side of the table. Your arm that's closest, thread it through and under. Fingertips come up onto the top of the shoulder. Isn't that fun? Like, it actually really is kind of fun how it just works so comfortably. Like, appreciate the simple. And then we're going to lean back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then slowly bring their arm back. Okay, we're going to keep their arm behind their back. Walk over the other side. Walk, walk, walk. Okay, one arm goes over the top of the shoulder, other hand goes under the arm, they match, and we're going to be tractioning down towards the opposite hip. So go ahead and traction down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now go ahead and hold right above the wrist. And I'll come show you when we do the final try. Okay, and hold above the wrist, and then we're going to traction and bring the arm down as if we're pulling it towards the opposite leg. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then release. Okay. Good, that looks good. Yeah. Okay, so now we're going to go ahead and just walk back down the back. Super slow though, so it's different than what we did in the Thai massage protocol because we were really focusing on stretching those tissues. So we go really slow with it. Okay. What? We're just walking down the back.
Okay, so you do one side, walk down the back, and then come, and then do the other side of the head? Or do both sides of the head and then walk?
Both sides. We're not doing the side of the head yet. We do that at the very end. Yeah. So we started with it. Yeah. No, we started with that, and then we went and. Yeah.
Scapula, and then you fall press down back.
Does that make sense?
Yeah, it's
Okay.
fine. I just thought I saw you do something else.
Yeah.
Right before the it's actually the shoulder direction.
Yeah, that's what I,
Yep. So it's that the palm press down.
okay.
Okay. So with this protocol, we started with tractioning by C7 and also the occiput, and then we did on the other side, and then we did this walking down the back that we're doing now, and then we moved to the pec stretches, that series that we did with the arm on both sides, and now we're where we are right now, walking down the back again, and then walking back, and then we're just going to end with that traction by C7 and the occiput when we get up to the top. Okay. Just nice and slow. So really feel that rib cage move. Can you guys feel it? Yeah, that's good. And hold it in that position for a little bit with compression, and then let it move back to neutral, getting movement through it. What, Annie? Okay, good. Okay, when you get back up to the top of the shoulders, get into your lunge, and go ahead and do that counter stretch at the occiput and on the upper trapezius. Okay. Holding, and nice long holds, at least 10 seconds, and then switch. Okay. All right, great job. So we're going to go ahead and we'll traction the leg again from this position. Okay. And then, actually I want to be in the lunge this way. Okay, so we're going to traction. And then those of you who have had Thai, which is I think most of you have had Thai. Who has not had Thai massage class yet? Okay. A few people. Okay. So this movement, I'll come help you with it because it's a little bit more tricky. It's twisting the foot out and in. And so it's just taking one side. You've got their leg in a traction. So you're holding right by kind of on the Achilles tendon and at the heel, calcaneus, and you're lunging back. So you're having traction. And then you take your hand that's free and you reach around the side of the foot. And you're going to start very close to the crease of the ankle. And you're just going to twist a little bit and you lean back as you do it. And it's just getting a little twist, a little stretch in the foot. So we're stretching it to the side. You're supporting the ankle here for stability, but see how I'm stretching that foot to the side? And then I'll move to the next spot, stretch that foot to the side. And then to the next spot, give a little stretch, hold. Okay, and then switch if you need to for your lunge, come back into that stretch or that traction, and then we're going to stretch the other side of the foot in the other direction. So laterally and medially. Okay. So you've got your hand, your fingertips are on the plantar surface, and you've got the heel of your palm on the dorsal surface, and you've got like a little wedge hooked around it, and then you've got the leg in traction. You're stabilizing the ankle, holding by the Achilles tendon and the heel there, so you keep it stable. And you're doing that to kind of protect the knee, because we actually don't want our knee medially or laterally deviating. We just have bend and flex, right? So flexion extension. And so we've got all that supported. Doesn't matter which side you start with, but support that ankle and then moving the foot and just giving a little stretch. Stretching and holding. Okay, stretching and holding. You guys all good with that? Okay, do that together. Okay, the next thing that we have is our stretching series. So those of you who also took Thai, this will be familiar to you. If not, don't worry. You can learn it now. So we're going to reach underneath the back of the knee, which is the popliteal space, and we're going to take their foot and we're going to put it right by our hip bone in front, the ASIS. Our outside arm is going to come around the side of their leg, and we're going to support. And then we can support, if you guys want to do the 1, 2, 3, 2, 1 presses, that's just assisting the stretch because you're kind of pinning in different places, and they'll feel the stretch in slightly different places as you do that, as you move. So we're going to go ahead and bring their leg to their sternum and lunge. 1, and then come back. 2. I would say probably hold these for about a count of 5 each. You could do longer if you want, but you're revisiting this so many times, that it's pretty effective just to do about 5. Bless you. Count of 5. Yeah, of course. Okay, knee to sternum, and then we let their leg fall out this time. and we're going to go knee to their armpit if they're very flexible. But if they're not super flexible, some people will still have their leg up like this just because they just don't have that flexibility. They've got tight musculature keeping them that way. But if they can, let their leg fall down, okay? And then you're going to press on the back of the leg, which is our hamstrings, and a little bit of the adductors, that inside of the leg. 1, 2, 3, 2, 1. You're going to different places in this pattern. 3. I'm anticipating that you guys will fly through this section because it should be pretty familiar to a lot of you, which will kind of carry the whole class, anyone that hasn't had this. Usually it happens. Okay, knee to the opposite shoulder. Sweep the knee across. Remember with this one that this movement needs to come from the hip, that we can't bring their knee up here and then try to move from the knee, the lower leg, which would hurt the knee, okay? So this, where we aim for the opposite shoulder, it's got to come from the hip being lifted and going across. We're going to lift up at the heel, and notice that I'm not pressing down, that I've got my palm cupped around that heel. So the Achilles tendon is where the heel of my palm is, and then it's cupped around the heel, and I'm lifting up and over, okay? Sorry. Oh, it's already too much of a stretch. Sorry. It's like feeling like I need to be a little dramatic about it to show you guys the emphasis, but
Hamstring flexibility.
yeah, it's okay. This will be good for you, but we won't go too much. Hopefully, since that happened, you guys got the idea, because now I can't show you. Okay.
So you can press and then
Okay, so we're going to press. So our fingertips are going to be out, and we're going to press, and then we're going to lift, and then we'll take them out of it. Sorry. Just like the, yeah, press, and then lift. Is that weird to know everyone's watching your face now?
No.
Okay, oh good. Okay, and then press, and then lift. Okay, so at least 3 times. And then we're going to bring their leg out, and we are going to do half split stretch. So we're going to straighten our arm, and we're going to just press their leg forward, and we'll press on the hamstrings in 3 places. 1, and then we'll hold for 5. And then come back, press, hold for 5. You could lunge this way, and then you'd have support for the outside arm, which is going to make it easier. And then come back. What? You could, yeah, you could use your leg. I am off the stage doing it, so I'm not quite where I should be, you know? And all of a sudden I'm kind of like, have a lot higher table. By, I don't know, 6 inches? Is that, yeah, something like that? I don't know. Okay. So you'll go at least 3 places, holding 5 times. And then we bring that leg in front of us, down into your heel, come into a lunge. You're going to take your forearm flexors, and they're going to be firmly pressed against the plantar surface, so the bottom of your client's foot. And this is going to stretch the calf muscles. So dorsiflex that foot by lunging forward and bringing their foot with you. Is that too much? And we'll go at least 3 places, pinning with a stretch on the quads, holding for at least 5 seconds for each one. I actually think, well, it's easy to do these on the mat too, for me, but I think that they are a little bit easier actually on the table to perform. Yeah, just a little bit easier. Okay, and then traction. All right, you guys ready to do this together? Did I miss something? I need to... Oh my goodness, this is a very important one. This is very important. Okay, which one did I put it after? Sorry. After half splits. Okay, so we were in half splits, and I'm doing it before then I do the calf stretch? Okay, so then we'll come here, and we're going to bend their leg, bring their foot to the opposite side, and then you'll hold the knee, walk around, or if you're not tall enough to do that, you can take their leg and bend it and then bring it over. Okay. And then we're going to go ahead and just press at the pecs and bring them around. And then we'll take our hand that was by the pecs and we're going to hold at the low back. Switch hands here so we can get a little deeper stretch. Come into a lunge, and we can even bring our arm around to stretch them a little more. And just make sure you have some support for them so they don't feel like they're falling. Okay, stretch at least a count of 5. And then bring the leg back. Support. Come around. And now we'll do our calf stretch. Okay. So lunging. And 1, 2, 3, 4, 5. Count of 5 for each of these. 1, 2, 3, 4, 5. Okay. And then traction. Okay, you guys ready to try it together? Let's go ahead and hold at the ankle. Choose a leg, any leg, and then lean back, traction. Let me know on the pressure, okay? And then we're gonna twist out. So make that wedge, twist, supporting the ankle for stability. 2. Hold about 5, count of 5 on each one. 3. So we're just going to go up and then release and then switch, traction. And we're going to stretch the other side of the foot now, holding for about 5 seconds, count of 5. Go 3 places, divide that space into thirds. Are you still doing okay with pressure? Okay. Getting some flexibility in that foot. All right. So now moving into our stretches. Hold at the popliteal space. Bend their knee. Bring their foot to your outside hip. Okay. We're going to use our hand and bring their leg up a little bit. We won't be able to have it be like this unless we actually really to the sternum, unless you got up on the table with them, which you could do, but then you'd be like fully up on the table, So otherwise you're going to be kind of to the side. You could put one leg up if you want to, and it will get you a little bit closer. Other than that, you're in a lunge. Okay, so we're going to go ahead and press on the quads. Press on the quads and lunge. Is that too much? Okay. And then press on a middle spot on the quads. Yeah, help her. And then press just above the knee, the quads, so just superior to the knee. Patella. Okay, now our next stretch, we're going to let that leg fall out to the side. And the knee's going to go up towards the armpit. You're in a lunge still, and you're going to be pressing on the adductors and on the hamstrings. So the inside part of your leg and also the back of your upper leg. Okay, hamstrings. Press and lunge. Is that okay right there? Hold for a count of at least 5 with each of these. It's a little different than our Thai massage class. Press for at least count of 5. But you're still dividing where you're pressing into thirds. The space you're working, you divide into thirds. Press, press, press. Okay. Knee to opposite shoulder. When you guys are ready, lift. So reach around. You're going to keep their leg bent for this. And you want to reach around with that leg bent. And you want to sweep that knee and that leg across their body, cross body, so that their knee is pressing or knee is pointing towards their opposite shoulder. If you want, you can put your leg up onto the table, and that will help you a little bit with some stability. And then fingertips go up around the heel. So the heel of your palm and center of your palm are around the heel. Your fingertips are up. And you're going to press with your fingertips out laterally on the hamstrings. Press and then lift. Good. Is that too much? Okay. All right. Find a second spot to pin and then stretch. Hold for at least a count of 5. Okay. Find another spot, pin, and then stretch. Nice. Very good. Do we have room for half splits? We do. We just barely have room. Yes. Yes? You can. You can. If that's accessible to you, you can do it. Yeah. Yeah, the leg can be fully extended if that's accessible to someone. Yeah.
Not everybody is flexible.
Yeah. Yeah. Uh-huh. Yeah. Yeah. Okay. Half splits. So bring their leg out into half splits. Whoa, we're so close. And then you can actually get into a lunge and support their leg with your thigh. So your outside leg can be bent. Yeah, supporting that lower leg. So just take their leg and go ahead and straighten, support above the knee and straighten her leg. Yep. So just hold right above the knee and the quads. And then slowly lift, push your leg up. I'll come show you. Okay, half split stretch. Okay, so we're going to find 3 places. We're in our lunge. We're supporting the leg. We're holding by the heel. Sarah and I are very close to the dividers. And then we're going to go ahead and lean forward and press on the hamstrings and a little bit on the adductors. And then we're going to come out of that stretch, find a second place, press. We're staying for at least a count of how many? 5. Correct. This feels like it's in the wrong place. And then come out of it. And then find another spot. Compress, lunge, give them a nice stretch. And then slowly come out of it. You can allow their knee to bend. Okay. And then while we're here, we're going to go ahead and take their foot across their body. Okay. And if you are tall enough to support their leg as you walk around, try it and see if you are. Then you can do that. You guys all able to? Okay, good job. Yeah. All right. And we're going to go ahead and take our hand that is closest to their head and we're going to support the pec attachments. We're going to go ahead and push their knee towards us, giving them a nice stretch. I'm going to move your leg out just a little bit right here. Okay. And then our hand that was by the pecs we'll bring to low back to support while we then switch hands. And then we're going to go ahead and pull our client towards us. Do you feel supported enough? Okay. Is it enough of a stretch? Okay. And we can do it again if we want to. A little stretch. Holding for at least a count of 5. Okay. And then roll them back. You can straighten their leg slowly. Walk down by their feet and then around. Hold onto their heel. And then this is where your forearm flexors go against the dorsal surface of their foot. So you line them up. And you're going to take your hand that's free and you're going to gently press just superior to the patella, so right above the knee. Be in a lunge and lean, bringing their foot with you, nose to toes, dorsiflexing their foot, giving them a nice gastrocnemius, soleus, Achilles tendon, calf stretch. So at least a count of 5 for each of these presses. There's so many words, Tui, you know? I said there's so many words. So many words. It's like, just do this. All right. So find 3 good places to press as you divide the space that you're kind of focusing your compressions on. Divide it into thirds along the length of the quad muscles. Okay. That's good. And then traction. Traction, traction, traction. And bring the leg back down. Okay, other side. Let's do this on the other side. Okay, let's go ahead and traction the leg, holding at the ankle, holding by the foot, tractioning, supporting by the foot, really holding at the ankle, but giving it a little extra. I feel it gives it a little extra right there. Yeah. Let me know if it's too much, okay? All right. Good, okay. Twisting the foot. So we're going to go ahead and stretch one side. Find 3 good places to do this along the length of either the lateral or medial side, and then switch. So if you worked lateral, work medial next. If you worked medial, work lateral next. Stretch one side and then the other. You look good. Yeah, and this is great. The lunge is great. A horse stance is great. If you feel stable, you can lean back too. Okay. All right, so now our stretches. So we're going to reach underneath the popliteal space. Bring the leg up. Good job, team. Good job. Water bottle recovery. That's good. Okay, that's great. All right, so we're going to support around the side of their leg, and we're going to press on the leg that's straight. Okay, so we're going to find 3 places to pin, and we're going to lean forward, lunge, stretch. Do you want more or less? Like right there? Okay. Holding for at least a count of 5, and then going to your next spot that you're pinning and stretching. Okay. And then our next spot that we're pinning and stretching. So 3 good places to pin and stretch. And you can get up on the table. Do it like full tie style if you want to. It's great. So if you did full tie style, Jen, is there enough room for you to step your right foot up by the hip? Okay. Like, is there? Because you'll have even better leverage. Yeah. Yeah. Okay, so after you've done that, has everyone done that movement? We're going to move the knee towards their armpit with these stretches, and we're going to be pressing on the hamstrings and a little bit on the adductors. So let their leg fall out, be in a lunge. So go ahead and push that leg up. Hold for at least a count of 5. I'm kind of going slow, waiting for everyone to get here. So for that one, you'll want to stand on the floor. Yeah, there's no reason to be on the table for that one. It's like way easier. And it makes more sense because you can bring their leg out. Yeah, yeah. Hold with stillness. And then find a third spot. Are you getting enough of a stretch? Should I go more? I could go like all the way to there. Is that too much?
No.
Okay. See how that's going to naturally make you breathe deeper? That's great. Okay. Are you guys ready for a knee to the opposite shoulder? Okay. So let's sweep. So we're going to hold around the knee and sweep around to the opposite side. Okay, so across their body. And for this one, you'll probably want to put one knee up onto the table because you'll be over the work a little more. And we're going to go ahead and press down on the hamstrings and then lift up at the heel. So you want, yes, good, perfect. And then fingertips up. Yep. And then, yeah, of course, at least a count of 5 for each of these. Lift up. So fingertips should not be touching. Yeah, good. Okay, find your next spot. Press. I'm trying to see everyone. Jerry, hi. Maureen. Okay. Good. All right. You guys ready for half split stretch? Hold above the knee to help that transition be nice and soft. Okay. And then you're going to be in a lunge. Your outside leg is the one that bends. And your inside hand, close to your client, is the one that's going to be pressing on the hamstrings and a little bit on the adductors. And you're going to go ahead and lunge forward. Is that okay right there? Yeah. Hold for at least a count of 5. And then come out of it slightly. Move to your next spot. You ready for this, Sarah? Right there? Okay. At least your count of 5. And then coming back. Okay. And your last spot, third space that we're moving to. At least a count of 5. And then coming back. Okay. And now for the pièce de résistance, which definitely does not sound French when I say it. Yeah. So we're going to go ahead and cross their foot over their body with their knee bent. And if you can, you're going to walk around. If you can't walk around, you just bring the leg down, and then you'll get this into position once you're at the other side. So let's see if we can walk around. Okay. Bring their arm close to their body. We're going to go ahead with our free hand, and we're going to compress very gently, almost no pressure at the pec attachments. Bring their knee towards the table. And then you're going to take your hand that was by the pecs and support at the hip so that you can keep them in this position. And then your hand that was by the knee goes to the hip. Your hand that was supporting by the hip can return to the pec attachments. You can reach your arm around and go ahead and bring your client towards you. Is that too much? Okay. Hold for at least a count of 5. You can move your arm or your hand up a little bit more on their back. And then hold again for a count of 5. Okay, let them roll back onto their back. Support under that popliteal space while you straighten that leg. Walk down by the feet again and then around. As you do that, you're going to hold onto their heel with the center of your palm, and you're going to make sure exactly that your forearm flexors are right against the plantar surface of their foot. Get into a lunge, and we're going to press just above the knee as we lean forward and stretch the calf muscles. Gastrocnemius, soleus, Achilles tendon 2, stretching all your muscles. I'm just kidding. It's not a real song. It's a real song now. Find 3 places, do the stretch. Okay. And then end with a little bit of traction of the entire leg. And then release. Good job, you guys. So we're going to go ahead and start with tractioning the leg. So go ahead and hold. Would it be helpful if we all start on the same side and I give a little more detail? Let's start on the left side for this round. So start on the left side and our client's left. So we're always going to be, yeah, I'm just going to mirror you. Yeah. But will it mess you up? Because I'll... Okay. You're fine. You're totally good. Thanks for telling me. Okay, so you're going to have your left hand close to the heel and on the Achilles tendon. Your right hand's going to go over the top of the foot, so the dorsal aspect, and you're going to go ahead and just lean back. You'll feel that traction through the hip. You'll feel the resistance. Right. Okay, and now we're going to take our fingertips and we're going to kind of wedge around. The heel of our palm's going to be on the top of the foot, the dorsal surface, and your fingertips are going to be on the plantar. Yeah, and you should be holding at the bottom with your left hand. And we're going to go ahead and just twist that foot. We're trying to get movement through this inside part. So we're trying to get some movement and stretch it. Okay, so that's the goal. So you're supporting and then you're stretching just that part of the foot. And you want to start down low, so start down by the crease of the ankle down here and then work your way up. Twist that part to give it a little stretch. Yeah, in Thai we do that. We're just going to do 1, 2, 3 on this and then twist. Just go up the entire length. But you certainly could add that in. That'd be fine. And good. Let's go ahead and switch hands that you're holding. So now your right hand's holding by the heel, the ankle, and you're leaning back. So you've got their hip and traction. Bring your left hand over, and we're going to get that same stretch through the side of the foot. So create that wedge. It feels a little awkward, but lean back and feel that side of the foot come out. Trying to get movement there and a little stretch. Next spot. Okay. Yep. So your shoulders, when you do this, should look pretty straight. Yeah, you're more leaning back than you... Good, yeah. Yep. Go to the next spot. And your wrist, so look at your wrist. Your wrist should be straight as you do this. And you can control that by either having it out more or bringing it in a little bit more. Okay, you guys look really good. You're in a relatively fixed position. So once you get your arm like this, then you are just simply leaning back. And then you're leaning back again. Of course, like it's not exactly like that because you've got the resistance of their foot too. But the idea is that you're just bringing them with you and you're just pulling that side of the foot up, getting some flexibility in it. Right. Okay, so our next movement that we're going to do, we're going to take the leg, we're going to support underneath the back of the knee, the popliteal space. I have to step off the stage for this because we didn't have enough room. And we're going to actually just we're going to let the leg be up a little bit, and we're going to bring it kind of to where the pec attachments are for this first one. Okay, so we're going to go ahead and press just to pin the leg that's on the table. So pin and then lunge. And we're going to start with the pinning on this one. We'll start a little more proximal, so closer to the body, and then we'll move more distal with it. And then come out, and then move to your next spot. It's going to look a little different for each person because we all have different levels of flexibility. Hold, 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 and then come back. If you want to do it Thai style and truly do need a sternum, you would need to get up onto the table to really be able to do it. Okay. Yeah. And then Latressa, you would take your right leg and stand up by her hip. Do you feel stable doing that? Yeah. And then come back. Yeah, it would need to be all the way up by her hip to give you that stability and that leverage. Okay. So moving to this next stretch, yeah, and then you're able to get, aim towards the sternum with that. Okay, and we'll just go slow with this. The next stretch, we're going to bring the leg out, and then knee, aiming kind of towards the armpit. You're in a lunge, just leaning forward. If your client is very flexible, you're going to need to be standing up closer to their waist. And then coming out of it. Yeah. That's good. Okay. Find 3 good places to press, to pin while you're doing this stretch. So we're doing this stretch 3 times. Okay. Yeah. Okay. So What? You're good? Okay, so now knee to the opposite shoulder. So reach around the sides. You're kind of holding by both the lower and upper leg around the knee. And then you're going to sweep their leg across their body. Okay. And then for this, you're going to put your right knee on the table. And then we're going to go ahead and press with our right hand on the hamstrings, the back of the leg on the hamstrings, and then lift with our left foot. So find 3 good places. We're going to go distal to proximal this time. So we're going to go further away from the body and then closer as we press. And then find your next spot, press, and then lift. Okay. When you're done with that support at the popliteal space, and bring them out into half split stretch.
Sorry.
What?
I haven't done Thai yet, so I'm telling you, I keep thinking not bad.
It's good. You're learning now. And then you want the heel of your palm around her heel. Yeah. Fingertips up. And then to keep your thumb with the rest of the family. So instead of having your thumb out, keep your thumb, the one that you're pressing. Mm-hmm. Yeah. With the whole family. Yeah. And then you're going to press first on the hamstrings. And then if it's accessible to her, you'll lift the heel a little bit more. Nice. That looks really good. And then just hold for at least a count of 5. Okay, so half split stretch. We're in a lunge. We are pressing. This time we're going to go distal to proximal, okay? So we're going to be further out and then go in. So kind of press and support. You can feel those tight tendons right there. Yeah, so go ahead and just kind of support that and then lunge forward. This is enough of a stretch for him. Some people, their leg will be all the way up by their head. So it really can just vary. And then come out, at least a count of 5. I'm going to straighten my client on the table a little more. Okay. And then find a second spot. Press, press, press. And come back. And then my third spot, closer to the body. More proximal now. Hold for at least a count of 5. Okay, good, you guys. Okay, we're going to support under the knee now, popliteal space. And we are going to take their bent leg, place their foot on the outside of their straight leg. Walk around. We're going to press the pec attachments with our free hand. Good, you guys. And then we're going to bring their knee towards us. Okay. Now with the hand, the left hand that was on the pecs, left hand will support the hip and will support here to keep in this position while our right hand comes and takes over. Then our left hand can go back to the pecs. And we're going to then kind of hook our arm around or our hand, and we are going to pull them towards us. Is that enough of a stretch for you? Okay. Yeah. And then slowly release, and then we'll do this one more time. Hooking around and bringing them towards us. And then slowly release. Good. Roll them back. So both hips are on the table now. And we're going to walk down to their feet, support under their popliteal space as we straighten that leg. Okay. Okay, our left hand. What?
You're on it now. Sorry. I missed
Oh, okay. Thank you. Okay, so we're going to go ahead and we're dorsiflexing the foot now. Okay, so the plantar surface of their foot is on our forearm flexors. We're going to walk around to the side, and then we are going to be in a lunge. I'm walking off the stage, so it's a little awkward, but we're going to lunge and press. We're going to press on this one distal to proximal. Hold for at least a count of 5, and then release. Find a second spot to pin on the quads and stretch. And then at least a count of 5, and then release. And then your third spot, lunge, compress. So pinning and stretching, and then release. Okay. Does anyone have a question? Do you guys have questions? Yes?
I don't know. I just figured that. I was doing this and then doing that.
Oh, yeah, straight arm and lunge. Yeah, that's good. You can do that.
Oh, I can just do that?
Yeah, that's fine. If it works, you want to also compress right there, but it'll probably work better to do this and then lunge more. So get into a lunge a little more. And then, yeah. Bring her with it. What are you feeling? Nothing? Do you feel something when you just have to bring her body with you? So, do you feel right there? If we do it at the same time, it won't. So, yeah, you just need to make sure. If you go here too, that's going to be even harder. You won't have stability. So maybe go on the inside just a little more. Yeah. And then you're dorsiflexing her feet. So you're trying to get this part, the ball of her foot, to move up towards her nose. So the goal is to toes to nose. Mm-hmm.
I found it helps maybe.
Do you feel anything?
Mine actually do help it start to go toes to nose.
If you tell them that's what you're doing? Yeah, that can be helpful so they don't resist you.
Yeah.
Do you feel it? So I see that it's just not carrying through your whole body. It's like the energy is dissipating somewhere else. You got to keep everything with your body stable in one unit. And you're going to lunge forward as one unit. You should feel a ton of resistance on your forearm. One unit. So you're kind of losing it here, leaning forward and just like dissipating the energy. Can you see it? And you got to stay with it and lunge forward and be strong. One unit. Strong. So this shoulder should not be going up. Do you see that?
Yeah, I can see that. But
Yeah.
Okay, are you doing it this way?
Yeah.
Putting your hand this way.
So lunge forward and drop that shoulder.
That's what I was doing, but then my shoulder goes up.
Yeah. So your shoulder should actually be straight.
So like this way it doesn't go up, but this way it goes up.
So relax it. Relax it a little bit and get more in a lunge. Get more to the side. Go to the side with your hand. Well, not that far. Look, I'm close. Yeah, just be in a lunge. Bend that knee more. Yes. Okay, and then tuck your hips under. Okay, and then lunge. Bring her foot with you. Okay, and we'll keep working on it. That looks better? Does that feel better? Yeah, that looks good. Looks good. Okay, let's move to the other side. Okay, so we are going to traction. We haven't done this side, right? Yeah, okay. So we're going to go ahead and traction, leaning back, holding for a count of 10. And then we are going to twist the foot out. And each one you want to hold for about 5 seconds. We're going to divide the space on the side of the foot into thirds. Yeah. And if you guys were, like when we're working the hand, you're just trying to get movement in there, get movement in there, opening that up. Okay. And then go ahead and switch. So now if you did the inside and you're holding the foot with your right hand, now you're going to be holding with your left hand to do the outside. Okay. Stretch. Good. Find a second spot to stretch. And then a third spot around that lateral edge of the foot to stretch. Good. Good, you guys. Okay, let's go ahead and support under the knee and bring their knee up. Bend their knee. Okay, if you want to be on the table, you can, because you'll be able to truly aim the knee towards the sternum. Otherwise, you're going to be out from outside their body, and that's okay too. You're just doing different stretches. Okay, so you're going to be in a lunge. Yeah, and those of you that are on the table, that's really good that you have your left foot standing by their hip. That's good positioning, and you'll have more leverage that way. Okay, so we're going to press on the straight leg, and then lunge forward. Stay there for at least a count of 5. 3, 4, 5. Come back. Find your second spot. Good. You guys all look good. Alex, you look good. Lunge. Be a little more of a lunge. Yeah. Looks good. You look good. And then come back. And then your third spot, lunging forward. And then coming back. Okay, let their leg fall out a little more. If their arm is in the way, you could have them move their arm up over their head. So you can move your arm up there if you want to. And now we're going to press. So we're going to support with our left arm around their leg and by the knee. And we're going to press on the hamstrings with our right hand. Starting distal and moving proximal on this one, okay? So we're going to go ahead and lunge and press. And then come back. Find a second spot and lunge. Pressing in a second place. And then coming back. And then finding a third spot. Pressing and lunging. Okay, good. All right. So you guys can see Robert's hip kind of rolling up off the table. And then if you have a more flexible client, that doesn't happen. So it's okay to have them do that. They're in a relaxed position because for me to have his hips not move off the table at all, then I could only go about here and he wouldn't feel any stretch at all. So even though I know sometimes in yoga we don't do that, but for him to get a stretch, his hip's going to come off the table a little bit with this. Can you guys see that? Yeah. Okay, so we're going to bend our client's leg. We just did, okay, so we just did, yeah. So we just did this last one here, and now we're going to do knee to opposite shoulder. Okay, so go ahead and push their leg across their body. You're going to place your left knee on the table by their waist. Lift their heel slightly with your palm. And then press. Yeah. Just above the popliteal space. Press and then lift just a little bit. It's going to look different on each person. Hold for a count of 5. Come out of that. Move to a second spot. Press. And then lift. Hold for about a count of 5. Come out of it and go to your third spot. Press. And then lift a little bit. Holding for a count of 5. And then coming out of it. Okay. All right. So now we're going to move into our, after we did that, we've got half split stretch. So let's go ahead. I'm having a moment up here. Having a moment with the equipment and thinking about this falling over. Okay. So, all right, I'm back. I'm ready. Okay, so, and I think I've got his foot in a place where it's not going to kick over the screens. All right, so I'm going to hold at the heel with my left hand, and then I'm going to press on the adductors and also the hamstrings just a little bit. And I'm going to be working distal to proximal with my compressions, with my pinning. Okay, so we're going to go ahead and lunge. You know what? If the screens fell, it wouldn't be that bad. It would be okay. You would what? Thank you. Okay, thank you. I appreciate that. That is very kind and practical of you. Thank you. Thank you. And then find a second spot. That's beautiful, Annie. Thank you. Annie said that if the screens fell, that you guys would just assist me. Thank you. Okay, and then come back. And then our third spot. And then come back. Okay, so now we're going to bend our client's leg, bring the leg over, and we're going to place their foot outside the straight leg. We're going to walk around. And we're going to go ahead and support pec attachments and bring their leg down towards us. We're going to take our right hand and hold at the hip and then keep them in this position. while we then replace that hand with our left hand, and then we can bring them towards us, bring their hips towards us. We have almost no pressure on the pecs. It's just for stability. Okay. Hold for at least a count of 5. And then take them out of the stretch and then bring them back into it again for a count of 5. Okay, we're going to roll them back onto their hips. Support under the popliteal space. And now we're going to do our calf stretch. Yes. Okay, so holding at the heel. Nose to toes, dorsiflexing the feet. So we want to get that flexion in the ball of the foot. Okay? All right, so go into a lunge, and we're going to press distal and then work proximal. So your first press is right above the knees, and lunge, bringing their foot with you with emphasis on the ball of the foot, toes to nose. And then move to a second spot. And stretch. Good. And then your third spot. You guys look good. Stretch. Okay. All right. You guys did it. You did this whole section. That was great. Okay, so this is going to be pretty simple. And eventually with all this stuff, it's really fun to keep getting training, but a lot of this is going to start being common sense for you because you'll be just learning to work with the body, you know? And actually, for most of you, it is starting to just feel like common sense, isn't it? Like after you do it, kind of, okay. Okay, so we've got traction the arm and then stretching the fingers. And then we're going to do some stabilizing of the pecs while we do some range of motion stuff. So kind of stretching back and then stretching the other way. And then we're going to take the client's arm and place their hand behind their back. And we're just going to do a little bit of a stretch that just kind of like, you can do this on yourself, feel it. So put your hand behind your back and then just give yourself a little stretch, bring it towards you. Okay, so that's what they're going to be feeling, but it will be an passive assisted. Okay. And then we'll traction the arm. So let's look at what that's like because it's pretty simple. So we're going to hold up here at the top of the shoulder and then we're just going to stretch back and traction. Okay. And then we have our next thing is just stretch the fingers. So we're just going to kind of stretch the hand out first. Both sides on the foot, we did one at a time, right? We're just going to do both sides here. And then we're going to go ahead and just stretch those fingers back, each of them together. And then we'll slide up and stretch those fingers back. Okay, similar to Thai, but just stretching back. Okay. And then we're going to move the arm out 90-degree angle, meaning that elbow's in alignment with the shoulder. And we're going to compress the pec attachments. And we're going to go ahead and just let the arm fall down. A little bit of a stretch. Going posteriorly. And hold for at least a count of 5. And then we'll go towards us, move out of the way, obviously. And we're going to compress the pec. And then move the arm in the opposite direction. Okay. And then we're going to go ahead and take their hand behind their neck. And we're going to come around and we're just going to, let's see, we'll support right here because I want for women to, ideally, it would probably feel good to be able to support here, but that's kind of a long stretch. So we'll just gently pull their arm up towards their head. Do you get a stretch there?
Not really. It feels
How
like
about if I come here and I hold your hand and then I kneel down and then I just take your arm like that?
Yep.
Okay. So if you put your hand on top of their hand, underneath their neck, and your fingertips are kind of on their back, and then you won't even have to work as hard, and then you reach around the side of their arm and bring it towards you, you're going to get more of a stretch for people who are really flexible. Okay. So we just have that, and then we're going to end with a traction. Okay. And then let me do this on the other side. So, tractioning And then we've got stretching the hand. So going back and forth and stretching, and then out each of the fingers, stretching them back, stretching those fingers back, supporting the back of the hand while we stretch that last finger. Okay. And then supporting at the pec attachments and gently bringing the arm so it moves posteriorly. Okay. And then supporting the pecs while we bring the arm in the other direction. Okay. And now for the arm stretch, we're going to bring their hand behind their neck. We're going to sit down at the top of their head, and I'm going to slide. So I'm going to be on the other side of their body with this hand and slide my hand under. So my fingertips are like it's C7. Okay. And I'm going to bring his arm down, and then I'm just going to gently bring his arm towards his head. Okay. You're getting a stretch from that? Okay. All right. And then we'll bring his arm out, and we just have our final traction. Yeah. So his hand is like right there, and then my hand came through the opposite side and went on top like that. And then my other hand came around and pulled like that. Okay. And I'll come around and help you guys. Okay, so then the next thing we're going to do is we're going to move to the neck. So we'll do this all as one sequence, okay? So the neck, let me just read them so that I make sure that I'm doing all of them. The neck, we have press on the musculature lateral to the spine, and then press up vertebrae by vertebrae to lift and traction the spine. So we're getting a little bit of like just movement in that spine and holding, giving it a lift and a little bit of kind of a stretch for the spine. And then releasing and then working our way all the way up. And then the next one we have is chin to chest. So this is where we cross the arms, support their head and come up. Some of you already know this. And then we have chin to the opposite shoulder stretch. This is where I'll be turning their head and then kind of like we did on the back, but just with the head turn. Little stretch. And then we have ear to the shoulder stretch, which is just bringing their ear to the shoulder. And then, again, your fingertips are just right there on the occipital ridge, and it's really gentle, and you're going to compress and stretch. So one is turned, one is with their head a little more straight. And then our final one is just tractioning the occiput, where we just take our fingertips, go under the occiput, and then we just lean back and bring our fingertips back. Okay, so I'll do those. So we're going to come under by C7, and we're just going to press our fingertips up and hold. 2, 3, 4, 5. And then release, move up a little bit, press up either side of the spine, hold. 2, 3, 4, 5, and release. Come up a little bit, and then press up with your fingers and hold. 2, 3, 4, 5, and then moving up a little bit more onto the occipital ridge. Pressing up, hold. 2, 3, 4, 5, and then I have room for one more space, and then I'm going to press up. 2, 3, 4, 5. Okay, and now I'm going to lift his head, and I'm going to cross my arms. This one, were we putting the hands over the? Yeah. So we had the hands like this under, and then like this, right? And then you're going to come into lunge and just gently stand up. Tell me when this is a stretch for you.
Right there.
Right there. Okay. 2, 3, 4, 5, and then slowly come back down. Okay, and then the next one that we have here is chin to the opposite shoulder. So this is where we're turning the head, that one. We just add these, and so the descriptions sometimes confuse me too, because it's like, you know the stretch, but you're like, okay, that's what we're calling it. Okay, That's what we're calling it. Okay. So chin to the opposite shoulder. So you're going to be on upper trapezius, and you're also kind of even on scalenes and stuff. So just right at the top there. And you're going to stretch that whole group of neck muscles. And then you guys will see it on this side. So you've got the head turn, and you're pinning and then stretching. Can you guys see it all through there? Okay. Hold for at least a count of 5. Okay.
And you're holding the occipital ridge.
Occipital ridge. Okay, and then ear to shoulder stretch. So we're still going to be, I'll do this side first. We're still going to be on the occiput, but I'm going to let his head be a little more straight. And then I'm going to bring that ear to the shoulder. What?
It looks a lot like the chin.
Well, there's no twist.
There's
My
no
chin is
twist.
towards the top.
So let me show you the other one. The other one is like this. Okay.
It helps me to think like levator and then
Yeah. Where do you feel the stretch?
Through the back of the neck.
Yeah. Yep. And then when your head is like this, see how that's like actually quite a bit different. And then I go ear and then compress. Where do you feel it?
Here, say here.
Okay. So he's feeling it through SEM. Yeah. With this one. Yeah. Yeah. Thanks. Okay. And then turn to the side. And then straight, just to see the difference. Ear to opposite shoulder. Okay. And then just our final one, fingertips spread out underneath the occiput, and then just lift, lean back. Okay. So fingertips up, and just lean back, and just hold for at least 5 seconds. Okay. Even longer if you want. It feels really good. And then release. Okay, you guys ready to do this together? We're going to take our left hand on the right side, and we're going to support up by right by the neck, top of the shoulder. Okay, and then we're going to hold just above the wrist, and then we're going to go ahead. We'll be in a little bit of a lunge, and we're going to lean towards their feet. So lean back and traction their arm. Okay, good.
Are we holding the shoulder down, or is it?
We're pulling it down. Yeah, you're pulling their shoulder down. Yeah. It's called, tractioning. Okay. All right. And now we're going to go ahead and we'll take their hand, and we're going to just kind of stretch their hand and then their fingers. So our fingertips are on the back of their hand, the dorsal surface, and our thumbs are around the palm, and we're going to stretch each side, pulling it out and then coming back. Okay, so you're on the thenar eminence. Yeah. And then stretching. Go ahead and just stretch and then come back. And then we're going to stretch each of the fingers. So take the thumb and the pinky and stretch. Good. All right, ring finger, pointer finger. Bring it back, supporting the back of the hand while you stretch. Is that too much? Okay. And then support the middle finger and stretch. Good. Okay, good job, everyone. Okay. Maria, are you okay even though you can't see me? Okay. Okay, cool. Okay, so we're going to take their arm out now, and it's a 90-degree angle. So their elbow is in alignment with their shoulder. Okay. We're going to press on the pec attachments, and then we're going to go ahead and push their arm towards the floor.
Like off of this table? Or
Yeah, yeah. Just make sure it's not too much for your client. Are you okay with this right now? Okay. Hold for at least a count of 5 or longer. And then you're going to bring their hand towards you, move out of the way a little bit, and then you're going to push their hand, their palm, down towards the floor. But just make sure it's not too much. You okay with that right there? Okay. So just feeling a little bit of resistance. Okay, go ahead and bring their arm back up. Okay, so now you're going to have your client place their hand right at the base of their neck. So bring it just a little bit lower. So about C7. Yeah. Okay. And you're going to come around to the top of their head. You're going to reach both hands under, and you're going to take your left hand on the left side of their body and then place your hand over their hand, but your fingertips are going to come down even lower. So your fingertips are on thoracic vertebrae, but your palm is right over their fingers. So your palm is over their fingers, your fingertips go onto thoracic. So down a little bit lower. Is everyone there? Just kind of supporting their hand? Okay. Take your right hand and press their bent arm down to the table, and then reach around the side of their arm, and then just bring their arm towards their head. Do you feel a little stretch right there? Is it too much? Okay. See if your client feels the stretch. Does your client feel a stretch, Susan? Does she feel the stretch? Good. Okay. Yeah. And then slowly release. Did you guys feel it? Okay, good. All right. So all we're going to do now is bring the arm out and then just traction. So traction just like we did before, shoulder and wrist. Okay. Okay, let's come around to our client's other side and do this on the other side. Okay. It's hard to make this into a 4-hour class. It still kind of went over, even with, yeah. Okay. So we're going to go ahead, take your right hand and place it up by the shoulder. Your left hand is down by the wrist, and go ahead and lean back, tractioning, tractioning, tractioning. Hold for at least a count of 5. Okay. And now we're going to lift, bend their elbow, and we're going to stretch their hand back and forth. You guys kind of have something similar in reflexology that you take called breaking chocolate. Do you guys remember that? Yeah. Yes. It's yummy. Chocolate, yum. So it's almost dinner time. Okay, and then stretching the fingers. Thumb and the pinky finger. Phalange 1 and 5, phalange 2 and 4, phalange 3 is last. It leaves you wanting more. Yeah, you're welcome. Okay, did everyone get all of the phalanges stretched? Yes, it's good. Yay. Okay, so now 90-degree angle. Okay. Compress on the pecs. Yeah. And then we're going to go ahead and push that wrist down towards the floor, going towards their head. Is any of that too much? Okay. Check with your client to make sure it's enough of a stretch, but not too much of a stretch. And then bring their hand towards you. Palm goes down towards the floor. Compressing in the pecs and then pressing by the wrist. Check to make sure it feels safe, that we don't overstretch. Okay, go ahead and bring their hand up. Okay, we're going to have them place their hand at the base of their neck. Come around and kneel by their head. Take your right hand and slide it under on the right side, and you're going to have the heel of your palm on their fingertips. And then your fingertips are down lower. Okay? And then we're going to bring their arm down to the mat. And then just gently bring that towards their head. Do you need more than this?
A little bit more.
Like right there. Is that too much?
No, that's
Okay. And just hold for a count of 5. 4, 5. It's good. Check and make sure that you're getting a stretch. Okay. All right. Go ahead and release. You doing okay? Okay. All right. And then we're going to traction again. Same thing we did before. So right hand on the shoulder, left hand by the wrist, and just pull that shoulder down. Okay. Let's go up to the neck now and do our neck movements. So So the first thing we're going to do is we're going to slide our fingertips under, and we're going to have our fingertips on either side of C7, T1. Sit down. And we're just going to press on that musculature, press your fingertips up, and hold 2, 3, 4, 5, release. Move up just a little bit more. You okay with that? Was any of that too much? Okay. Press and hold. So lift and hold, essentially, is the idea. So lifting. And then releasing. Yeah, that looks really good, Jen. Lifting and holding. That looks good. That looks right. Yeah. And your hand is supported by being on the mat. So your hand is completely on the mat. The back of your hand. Your fingertips are pressing on either side of the spine. Okay. Okay. Good. So now our stretches. So the next one is going to be chin to the chest. So we're going to lift their head up and then take one hand. We're going to cross our arms. So you're going to place one hand on pec attachments and then reach your other arm under on the other pec attachments. We're going to stand up with one foot and then the other. Let me know when you have a stretch, okay? More?
More, yeah. There.
Okay. And hold for 5, 4, 3, 2, 1. Slowly release and come back down. Okay. Support their head when you take that arm out. Support and then bring their head carefully back down. All right, so we now have chin to the opposite shoulder. So this is the one where we're going to turn their head gently. So our hands are cradled around the occiput, and we're going to gently turn their head to one side. Okay, and their head is resting on your hand now. So I have her head turned to the left side, and her head's resting on my left hand. So if you turn to the left side, then their hand is resting on your left hand. If you turn them to the right, then their head is resting on your right hand. Okay. So with your free hand, you're going to press right close to the neck. So you're not going to actually be on the shoulder. You're going to be right on upper traps and also scalenes. There's a little bit, there's a whole bunch of muscles that you're actually on right there. So pressing, and then you're going to also lift right at the occipital ridge. So you've got a counter stretch here. Hold for at least 5. Then go ahead and bring your free hand back to the occiput and roll their head into your other hand. Sorry, my tongue is tied for a minute. Okay. Now we're going to do the same thing on the other side. So pressing upper traps and then lifting at the occiput, counter stretch. Hold for at least 5. Okay, and then slowly release. Roll their head back. This time we're going to have their ear go to their shoulder. So their head stays straight like this. We don't turn it to the side, but we just very gently, we're going to take, so let's go to the left side first. So it's going to be your left hand that will go over to the right side, and it's going to hold right at the occipital ridge very gently, and then your right hand is going to press on upper traps, and you're going to bring their ear very gently with your left hand towards their shoulder, towards their left shoulder. So pressing with your right hand on the right side, gently with your left hand, moving their head towards their left shoulder. Holding for a count of at least 5. Does anyone need help? If you need help, raise your hand and Kyle, come over. Okay. Bring their head back to center. All right, so we had left hand here. Okay, so now we're going to take our right hand, okay, on the left side, and then we're going to press with our left hand. I don't want to pull your hair. Is it okay? Yeah. Okay. And we're going to counter stretch. bring the right ear to the right side. Good. Hold for at least a count of 5. And then bring their head back to center. Okay, so we're in our last movement. So we're going to take our fingertips and we are going to, your hands are like this around their occiput and your fingertips are in their occipital ridge. Okay, and you're going to go ahead and just straighten your fingers and lean back and hold. Okay, so slide your hands under, press your fingertips up into that occipital ridge, and then just lean back. It's pretty gentle and just hold. Good, you guys, and then slowly release. Okay, great. I am on my client's right side. So I'm going to use the hand position for the right side, okay? If you're on the left side, it's going to be the opposite, okay? So on the right side, my left hand is going to go up by the shoulder, and my right hand is going to be down by the wrist. And I'm just going to lean towards my client's feet and bring their shoulder with me, traction. Okay. Hold for at least a count of 5, and then release. And now we're going to take the hand and stretch it. So we're going to start by the heel of the palm, and we're going to stretch both sides back, and then forward. Move up a little bit, stretching back, and then bring that tissue forward, and then go up a little bit more, pushing back and forward. And now we're going to stretch the fingers. So thumb and pinky, 1st and 5th phalanges. Okay, ring finger and the pointer finger. 2nd and 4th phalanges. And then finally, our 3rd phalange. Middle stretch. All right. So next, we are going to bring our client's arm out so that their elbow is in a straight line with their shoulder. We're going to press on the pec attachments with our right hand if we're on the right side and our left hand if we're on the left side. Okay. And with our other hand, we're going to press kind of by their wrists and press their hand down above their head, press it down towards the floor. Check to make sure that it's the right level of stretch for them. Do you want more than this? Do you want less, or is it okay?
It's fine where it is.
Okay. Okay, hold for at least a count of 5 and then bring their arm towards you. Step out of the way and press their hand down towards the mat. Down towards the floor for at least a count of 5. Okay, so now we're going to have our client help us. We're going to have them take their hand and put it behind their neck, so at the base of their neck. So they want their fingertips at least by C7. Okay. We're going to come around by their head. Let's come around by their head. Sorry. And we're going to kneel down, or you can sit in this chair. Okay, because my client, I'm working on the right side, I'm going to take my left hand on the left side and I'm going to slide. So I might support his head too and lift it just a little bit with my right hand, and then slide my hand underneath his body, and then have the heel of my palm by his fingertips, and my fingertips are down on the thoracic vertebrae. I'm going to bring his head back down, and then I'm going to bring his arm a little bit with my right arm down to the table, and then I'm going to bring his arm towards his head. Is that a stretch right there? Do you want more? You want more like that?
Yeah, it's good.
Okay, hold for at least a count of 5. 5. Okay. Did you try it? Oh, so it's not even a stretch for you. That's okay. It just means you're really flexible. Okay. All right, so we can bring their arm back out, and now we're going to return to that traction that we started with. So shoulder and wrist traction. Good. Okay. All right, let's go ahead and move to the other arm. Okay, so I'm on the left arm. My right hand is up by the shoulder. My left arm is down by, hand is down by the wrist, and traction. Hold for at least 5. Count of 5. Bend their elbow. And now we're going to go ahead and we're going to stretch the hand. So stretching, starting at the heel of the palm, making your way up. Yeah. And then we're going to stretch the fingers. Thumb and pinky, first and fifth phalange. Then second and third. Second and fourth, and then the third. The middle finger's last. Yeah. Stretch. Okay. Bring their elbow in alignment with their shoulder. And then we're going to go ahead and press at the pec attachments. And we're going to push their hand down towards the mat. Do you need more or less the stretch?
That's pretty good right there.
Okay. Okay. And now step out of the way a little bit. Bring their hand towards you. Pressing on the pec attachments and then pushing their hand, their arm down towards the floor. If I said mat, that is from teaching Thai massage, and I meant floor. Floor. You knew what I meant. Okay, so now we're going to ask our client to put their hand at the base of their neck. We're going to come around, sit down at the top of their head. Okay, we can take our hand that's on the same side as their arm that's bent, and we can lift their head a little bit. This will allow us to slide our opposite hand under. And we want our hand to be the heel of the palm at about C7 and your fingertips down on the thoracic vertebrae. Okay, you're going to kind of spread your fingertips apart so they're not directly on the spine. And then you're going to push your client's arm down to the table. And then you'll come around the side of the arm and you're going to go ahead and bring their arm towards their head, towards the side of their head. Can you feel a stretch there? Okay. Hold this for at least a count of 5. Are you guys doing okay there? Did you already do this, Maureen? Okay. All right. And then our final movement with this little section, we're going to bring their arm down and return to the traction. Tractioning. Okay, home run stretch. So the neck. Let's go ahead and come up to the neck. Okay, so we're going to start at C7, and our fingertips are on either side of the spine, the erector spinae musculature, and we're just going to be lifting for a count of 5 and then releasing, working our way up to the occipital ridge. Okay? So go ahead and reach under, and lift. Count to 5, slowly release, and then move up a little bit. Lifting for a count of 5, and then slowly releasing. The back of your hand is pressed into the mat, pressing up with your fingertips. Hold for a count of 5, and then slowly releasing. Then we'll do one more. Pressing up, and then slowly releasing. Okay. We're going to bring their chin to their chest now. Take your left hand and lift their head up. Slide your right arm under and rest your fingertips on their pec attachments around the shoulder. Okay. Lift their head with your arm, slide your other arm under, rest your fingertips on the opposite shoulder, and then stand up with one foot and then with the other foot. And we're going to go ahead and lift. Let me know when this is enough of a stretch. Bring their chin to their chest. Do you want more, Robert?
That's pretty good right about there.
Okay. Straighten your back. Hold for at least a count of 5. And then slowly come back down. Okay. Slide your arm out that's closest to the table. And then support the head with that hand. And then slide your other arm out. Okay. We're going to, with our client's head cradled in both of our hands, our fingertips are on the occipital ridge, and our fingertips are behind their ears. We're going to roll our client's head to the left side. So roll the client's head to the left side. Your fingertips are pressed into the occipital ridge on the left side still. You're going to let your right hand be free. Press to the top of the shoulder, right by the neck. Press and then pull on the occiput. So press with your right hand and pull towards you with your left hand. Hold for at least 5. Okay. Release. Slowly roll their head back to neutral. And then roll their head to the right side. Turning their head to the right side. Fingertips on that occipital ridge on the right side. And then we're going to press. Right? Yep. With our left hand, and then pull with our right hand this time. Hold for at least 5. Okay, slowly release. Okay, this time we're going to take our left hand out and we're going to move our left hand to, actually, it's going to be like this. So it'll be our left hand, but it'll be right to the side on the occiput. So kind of where the hand positioning was before, but you're going to cross over to the opposite side. Okay, so take your left hand over to the right side and press into the occiput on that right side with your left fingertips. Got it? Okay, and then with your right hand, press on the upper trapezius, and then we're going to keep their head straight. Yeah, and just let their ear go towards their shoulder. It's going to look different for each person because you'll all have different levels of flexibility with this. Is this a stretch for you?
Mm-hmm.
Okay, hold for at least 5. Okay, let their head return back to the center. This time, right fingertips on the occipital ridge on the side, on the left, and the, yep. So switch hands. So we're going to go ahead and counter pressure. So pull the occiput towards you, and their ear goes to their shoulder. And then you're going to press on the upper trapezius. Okay, hold for at least 5. And then come back. Okay, the last thing we're going to do is our fingertips are going to go around the occipital ridge on both sides. And we're going to push our fingertips up into the occiput, and then we're going to just lean back and hold for at least 5 seconds. Okay, and then go ahead and slowly release. Okay, you guys did it. Now you just have to practice, but give yourselves a round of applause.